Thank you for the wonderful introduction, and indeed it's exciting to be the first panel of the morning. I'm honored to join the workshop and also speak with you today. So I want to talk with you just a little bit about school mental health and then some things that we're doing at the Center for School Mental Health to support our professionals who are in schools right now. So these are postgraduate professionals who probably require some sort of training and oversight and support to continue providing quality mental health and health care for children in schools. So I'm here on behalf of the Center for School Mental Health. Our center has been funded since 1995 by HRSA. We focus on advancing school mental health policy, research, practice, and training, and really emphasize a shared family, schools, community agenda. Our co-directors, Dr. Sharon Hoover Stephen and Nancy Lever, actually lead a faculty and staff of about 40 people, and we're right up the road in Baltimore. So this is probably no surprise to anyone in this room, but we know that mental health in schools is probably particularly important because mental health conditions really develop in childhood primarily. The later onset conditions are really mostly secondary conditions, and severe disorders are typically preceded by less severe disorders which went untreated. There was some discussion of this yesterday. We know from the epidemiological data that in a given classroom of 25 students, 1 in 5 will experience a mental health problem of mild impairment. 1 in 10 will experience a mental health problem of severe impairment, and less than half of those who need it will get services. So there's a tremendous need out there for serving mental health disorders in particular in schools that are simply not being addressed at this time. And what many don't realize is that of those who do receive services, over 75% of those who do so receive those services in school settings, resulting in the reality that our schools are becoming the de facto mental health system for our children. So I just want to spend a moment on how we define comprehensive school mental health, what our framework is for this, because it tends to have a lot of different connotations, especially depending on which professional perspective that you're coming from. And this is a definition that we've been working with for many years now, and also is the current federal definition by HRSA, who's our primary funder. So when we speak of, quote, school mental health, we're talking about a partnership between schools and community health and behavioral health organizations, guided by youth and families. Partners who are augmenting or complementing the supports in the school are building on existing school programs, services, and strategies. So they're really utilizing what's there. And it's focusing on all students. So really emphasizing both those students in special education, but also those in general education as well. So thinking about the entire student body. And instead of focusing on only those students who are already exhibiting mental health needs, which would be the tertiary level of care, we really emphasize providing a full array of evidence-based programs, services, and strategies within a multi-tiered system of support. I love this slide because I think it well demonstrates how having a community partner who's working in concert with the school system can complement the focus that's there to the public health triangle. So the primary mission of schools is, of course, those educational outcomes for students. And when it comes to social, emotional, and behavioral health, they're primarily focused on mental health promotion for all students, as well as targeted prevention for some students, and then the top of the blue triangle, which is intensive supports for a few students. You see, when you introduce a community partnership or other supports in the community, you're able to really complement that by bringing in someone who focuses primarily on those intensive supports, as well as some targeted prevention for some, and then hopefully they're involved in the mental health promotion activities to whatever extent is feasible for that school or district. But the idea is that the community partner would actually be engaged in all parts of that triangle and really embedded within the school setting. So who are these providers? Who provides mental health services in schools? Well, we have some previous data that tells us a little bit about this. We know that there's some combination of school employed, so your school psychologist or school social worker, and community or community employed mental health providers, as well as other health providers. But given that there's almost 100,000 public schools in this country and 18,000 districts, this is a pretty big job. And so So I'll get to that in a moment. That's part of some of the work that our center is doing now and updating those numbers with our national census. And those actually, and that pie chart doesn't even represent the natural supports in schools. So your teachers, your school staff, your school nurses, parents, everybody else in a school that really supports mental health services. And this is not an exhaustive list, but gives you a snapshot of how multidisciplinary work in schools actually is. This is actually a list that we have on our website, the shapesystem.com, which I'll tell you about in a moment, that actually says to professionals who are interested in being part of this website, hey, look around. Who else might be on your mental health team? And how can you build a multidisciplinary team of providers who's supporting student mental health? And we see these teams in schools and districts being more and less multidisciplinary. I'd say that it varies a great deal across the country. So I want to talk with you about 3 strategies that the center is taking on right now to support professionals' role in school-based behavioral health. And so we're thinking right now about what are those competency drivers to focus on when we're talking about implementing school mental health, right? So these are professionals who've finished their graduate degree for the most part, not on all cases, but really thinking about what the evidence base tells us, which is that doing one-time training or workshops are really not sufficient for ongoing behavior change and quality of evidence-based practice provision. So looking at the selection, training, and coaching associated with improving the competency of mental health and health providers. So a few of the strategies I'm going to tell you very quickly about. One is a self-paced online training for individual clinicians, which can be found at mdbehavioralhealth.com. It does have MD for Maryland in the name, but it is nationally available public access. We also have some web-based strategic planning and quality improvement platform for school mental health teams, and that can be found at theshapesystem.com. And then we've recently been doing some exciting work with learning collaboratives in 25 school districts across the country who are working on some great rapid cycle quality improvement work. Okay, so in terms of the first strategy, this is just a few screenshots about what MD Behavioral Health looks like. As you can see, this is the very first overview module of a series of learning titled Community Partnered School Behavioral Health. And it really is based on adult learning. This is Sharon Hoover-Stephen, the co-director of our center. And you can actually see that it's pretty interactive. There's audio, there's video, you can download PDFs, you can take quizzes, you can save and return. There's also continuing education units that are available for professionals who complete each of these courses. And there's also some live demonstration and role plays, and some of them are actually quite powerful, I think, but really trying to get more to kind of that skills teaching a little bit, even though obviously the provider is just listening and watching this and not rehearsing those skills themselves, but there are some role plays and demonstrations. So this is an example of the different modules involved in the Community Partnered School Behavioral Health Implementation module. So you can see there are a variety of topics that may be useful to somebody who's working in schools. And some of these even include basic information, like the language around what terminology to use when you're in a school setting. There's a lot of sort of code switching, I think, that goes on, as we talked yesterday in our table about the different service settings that providers might find themselves in. So the second is a web-based platform for strategic team planning. This is part of the National Quality Initiative funded by HRSA in partnership with the School-Based Health Alliance, which is our partnering organization. And this is a little bit about the SHAPE system, which I won't go into in detail, but I want to show you a little bit about what's on there. And basically, it houses a national school mental health census, the first of its kind in about 11 years, and also standardized performance measures where teams can self-assess their performance in quality and sustainability. And the goal here is to provide some accountability, but also support the excellence of mental health services being provided in schools. So schools and districts can use SHAPE to document their service array, multi-tiered systems of support. It's really intended to advance a data-driven mental health team process. They can access tons of targeted resources to advance their school mental health quality and sustainability, and there's some recognition components associated that may be helpful to them. This is what the dashboard looks like. I know this is like a lot of information for a very short talk, so hang in there with me. But this is what the dashboard looks like, and it essentially provides a virtual workspace for their team. And so our learning collaboratives are basically, as some of you may be familiar with other learning collaboratives, where the goal is not to advance your learning as a team by your boss telling you what to do or finding something on the web, but actually sharing ideas, testing things in very rapid cycle approaches. So our learning collaboratives are testing some innovative practices. They're thinking creatively and strategically about how to improve the quality and sustainability of their services. And our goal is to disseminate these interventions and innovations that they're doing for quality improvement nationwide to the field. Some of you may be familiar with this. It's an adapted methodology from the Institute for Healthcare Improvement Breakthrough Series model. So this is the methodology we're using. And currently we have 25 district community school mental health systems who are participating in our learning collaboratives. We have our first cohort on the left-hand side there wrapping up in December. Our second cohort just started with us in September. And what we hear from them when they come to our very first 2-day in-person learning session in Baltimore is that we've never done this before. We've never sat down as a team, even if they are already a multidisciplinary team, and talked about how do our school mental health services look in this school or in this district, and what can we do to advance the different aspects of that as a team to improve the quality of care for students. And they're also using the SHAPE system each month to document that progress. And so far, we're hearing about a lot of positive benefits of their participation. So thank you very much.